Hi, my name is Melissa Grace,
And I'm Stephanie Wynn.
and we're doing our video on the skill set of the IV Start. Before we get down to the actual skill itself, we're going to do just a little quick information segment. Before you would want to go meet your patient with your IV things, you want to make sure you have a valid doctor's order, and you want to have all of your supplies gathered to show that you're prepared before you walk into the room. We have set up a table in this video to show you a common set of supplies you would use when starting an IV. And of course, when you go into the patient's room, you would make sure that you have identified your patient, that you have the correct patient. You would check against any allergies, and you would wash your hands with soap and water before getting started. We have prepared here a mock setup, as if we were going to start an IV on our patient, of some things that you would want to gather. The first thing you'd want to gather is a pair of gloves. Most facilities are latex free now, but you'll definitely want to make sure that you either have latex free gloves or that your patient does not have a latex allergy if using latex gloves.
The first one would be a 24 gauge, which is typically for your pediatric patients. It's in the yellow. The blue one is your 22 gauge, and that's for just general medications, IV fluids, that kind of thing. And then your pink one is your 20 gauge IV, and that's typically for blood or going to surgery. You're going to want to start with a 20 gauge. Your 18 gauge is your green one, and that's for trauma patients or anything where you need to give something really fast and high flow.
Definitely always check your doctor's order.
The next thing we've gathered are some 10cc sterile normal saline flushes. These come packaged, so they're sterile. And we have some extra alcohol preps. We have a Lorlock to hep lock our IV. Of course, you're going to want to check your physician's order to see if he wants a hep lock or he wants continuous fluids or how he wants that IV. You're going to grab a IV start kit. This includes a coverter, a tourniquet, some tape, some 2x2 gauze, chlorhexidine prep, and then we'll add a Band-Aid.
My name is Melissa, and I'm a nurse here at William Carey Hospital. I'll be your nurse today.
Hello.
Hey, do you mind if I start by checking your armband?
Okay.
Okay. Can you state your full name for me?
My name is Stephanie Wynn.
Okay. And your medical record number?
1, 2, 3, 4, 5, 6.
Perfect. Okay, you're always going to want to start by making sure that you have the right patient before you let them know what's going on. All right, Miss Wynn, or do you prefer to be called Stephanie?
Stephanie's fine.
Okay, Stephanie. Your doctor has ordered for me to place IV access on you today. Do you know what IV access is, or have you ever had an IV?
I've never had an IV.
Okay, no worries. I'm going to go ahead and let you know what he has in store for you, okay?
Okay.
An IV is a needle with a cannula on it. A cannula is another word for a small piece of plastic. What he would like me to do is to place this cannula into your vein. In order to do that, you'll have a little slight sling. I'll go ahead and advance the piece of plastic into your skin, which will stay secured and with you at all times. We'll be able to give medications, blood, and other orders that way. Is that okay with you? Do you have any questions? It does. Have you ever had a shot?
Yes.
Okay, so it's very similar to that. You'll feel a bee sting type pain, a little sharp pain, but then it's quickly over with and only the plastic remains. It's important for you to know the plastic is flexible, so it won't limit you moving your arm or using your hand or anything.
Okay.
Okay, is it okay to proceed?
Yes.
Perfect. All right. Well, Stephanie, I'm going to step away just for a quick minute to make sure that I wash my hands before we get going.
Okay.
You're going to make sure that you wash your hands with soap and water, and it's always great to do that in your patient's room, assuming that you have a sink and soap as you should in there. You're also going to make sure that you have a red bin close by where you would put anything that may become soiled during the procedure and a sharps container for safety purposes. After that point, we're going to begin to assess Miss Wynn's skin and kind of look for an ideal site. So you'll begin to do that by taking your patient's arm. Now, in this case, Miss Wynn is a young, healthy patient. So for Stephanie, we don't have to look very difficult to see that we're probably going to have a lot of great options. But that's not always the case. In older patients, and just in patients that maybe have had trauma or surgery, you're going to want to make sure that you're avoiding certain areas of the skin. If there's any open wounds, of course, any other dressings, any areas of large bruising, abrasions, you want to avoid all of that, okay? You want the healthiest piece of tissue that you can find is what you're looking for. Also, it's important to note that an IV start is not a sterile technique. It is a clean technique, but you want to remain as aseptic as possible for sure. And you definitely want to start proximal to distal, okay? You have to think about your patient's comfort. Many nurses assess the antecubital first, and all the antecubital here, which is the bend of the elbow, often contains a lot of larger veins that are easier to access. It's not always the most comfortable for your patient, especially those who are on continuous fluids or medications, as it can often occlude the vein or stop the flow when the arm bends or require your patients to keep their arm straight, which is also very difficult for young patients. So you want to look with the hand and move up if you don't find something else. In order to make veins more visible, our first step here is going to be applying a tourniquet. Are you allergic to anything, Stephanie?
I am not.
Okay. Now, most facilities are latex free at this point, but some are not. You definitely want to always make sure that you're asking your patient about their allergies, and it's okay to ask several times. Safety is number one for sure. This tourniquet can be tied right here, and this is a skill you can definitely practice. We'll go over that a little more in depth later. It'll be tied. You want it to be snug, but not painful. So you want enough pressure there that it's going to kind of constrict and show us some good veins, but it should not cause your patient pain or leave marks or bruising. So be mindful of that. Also, it's important to note in this step, not all patients are candidates for a tourniquet. Some of our older patient population that has very superficial, large, bulging veins, as you can see with the eye, that's not something you would apply a tourniquet to. That pressure can cause the too much pressure on the vein, and the irritation from the IV can make it go through the vein or create a hematoma, a collection of blood around the vein. So you definitely want to make choices that are patient specific, okay? So we will have tied our tourniquet here. At this point, you can make suggestions to your patient on things that may help the process of finding a vein. You can ask your patient, like I'm going to do now, Stephanie, would you mind pumping your fist a few times? We're just going to find a good vein here. Okay, so that's just perfect. Now, it's important to see if you can, since she is young and has no other skin issues or anything, we're already seeing some really nice veins here. So, of course, your veins, you can kind of feel a buoyancy there, so you're going to want to assess that. It's important to touch your patient's skin. Of course, if your patient has any opens, wounds, sore, weeping, or conditions that you should know about, you would need gloves for this part. Otherwise, you can be clean and kind of just check here. You're looking for the straightest vein and the one that you have the most confidence with to just do one stick. So it's really important. Now that I've kind of picked out a spot that looks great in her hand and is in a comfortable position, to re-clean. I have some hand sanitizer here, so I'll do that at this time. All right, Stephanie, just re-cleaning so that we're both safe and keeping all those germs away from this, okay?
Okay.
All right, and then I'm going to make sure to grab a pair of gloves. Again, most facilities, these are latex free at this point. But just reconfirming, Stephanie, no latex allergies that I should know about?
No.
Okay, just perfect. And we're going to get her skin cleaned as well too. And make sure you're comfortable and your patient's comfortable. In this video, I've placed a pillow on my patient's lap just to make the working height better and for the video purposes. So I'm going to take some alcohol and do 20 seconds of good cleaning here. Okay, and once those 20 seconds have gone by, I'm going to discard that into a trash can. Now, if for some reason something changes between that step and you can no longer visualize the vein, or you decide on a different side, or you touch anything, you'll want to re-clean any site, okay, if any time has gone by. So you're going to make sure that's good and dry there before you start to access the site. All right, Stephanie. The next part is looking at our IV here. Okay, so each manufacturer has some specifics that you'll want to address. Some use a button, some have no other devices. Those are really up to your facility and manufacturer. If it's a IV that you have not used before, you're gonna make sure that you're very familiar with it before you go in, okay? You definitely don't want to be learning on the job, literally at your patient's risk. So there's a plastic protective covering here, and we've of course made sure this is not expired in any way. And this will be removed and discarded. Careful not to really touch anything here. There is a little lever right here where you can see that the catheter is separate from this plastic cannula area. So you're going to make sure that that is free and that you can maneuver that it will twist off, since that's the portion that'll be remaining with your patient. Okay, so once you've done that, you should always notice that below the color, which indicates size, in this case an 18 gauge of green, this clear area here where the tip of the needle is the area where you'll see flashback, which is another word for blood return, okay? And that'll be your first indication that you're in the right spot. As soon as you see that flashback, you're going to want to stop advancing the needle, and then at that point just advance the plastic catheter. Okay, so that's what we're going to do now. Now, since it's been just a little bit, I'm going to re-clean Miss Wynn's site. Okay, I have discarded that. Now you're going to make sure that you apply just a little pressure or turgor to the skin to make it nice and taut. You want the skin to not be a distraction and not be an interference with your stick, okay? Now for some patients, there's different ways. Some people press down. You might have to apply more pressure to some people's skin, less to others. It depends on the looseness of their skin. So that's something you'll kind of just adjust for on a patient by patient basis. You want the bevel of your needle. I'm trying to make sure you guys can really see that indentation there, that slant, that is called the bevel. And the bevel should always be facing up, so anteriorly. So you're going to make sure that everything is good. Everything looks great there. Now you'll take the bevel of the needle and you want to put it right next to that spot you're going to stick. And then of course this is where you'll start to advance the catheter. For training purposes, we have some tubing here with some red dye to signify blood flow, okay? So as soon as you get that blood flow into our plastic portion here, you will, and you'll see I'm taking my finger here and pushing up, you will push up and advance that in, okay? So you'll be holding some pressure there, and you'll want to go ahead and pop the tourniquet the minute you see that flashback and go ahead and advance that cannula in. That allows it to continue to flow while you still have your hand there for some pressure. Facilities have a variety of materials, Tegaderms, Coverderms, tape, and as long as your patient has no allergies, in the case of Stephanie, she has none, so we're just going to secure that device there. Now you're going to want to start immediately securing in this area, and then that frees up both of your hands to provide additional securing on her arm. So you want to do a few more pieces of securing device just to make sure that this is really good and in there, okay? Patients move around in the bed, they can hit against pillows, side tables, getting out of bed, and we don't want this thing to come out once it's in. So now that that's there, in the case of her, there's like a little end cap, a little hub on most of these that we don't have available for our training today, but allows you to access it. And we use saline to check the patency or the flow of our IV. So all you would do, maybe, let me see. Okay, I do have a hub. So you would twist this hub that is great for saline locks right here. You would twist the saline right on that, and you would begin to press the saline to check for the patency and the ease of flow. So I would definitely warn my patient, you might feel a little pressure. This is normal saline. I'm just making sure your IV is good.
Okay.
As you start to apply that, Your patient should not be eliciting any symptoms of pain. They might be able to feel the pressure a little, but if for any reason your patient yells out, says that hurts me, you want to immediately stop and assess your site. Either way, you want to take a good opportunity to assess your site. You're looking for there to be no redness, no irritation around the skin. Of course, in darker patients, redness can be very difficult to assess, so you do ask about the irritation. You look for signs of infiltration. It can be as slight as a slight puffiness around the site, sometimes at the point of insertion, sometimes right next to it, all the way to a large bulging at the site, like a bubble. That's called a hematoma, which can be a collection of blood, or it could just be a collection of fluid from the saline. And then, of course, just general irritation. Now, every facility has policies on site care and the date on which you change your IV. For most places that we've personally worked at, it's been about 72 hours when you want to completely change out your IV. But of course, anytime you're in your patient's room, which should be frequently, and during your assessments, you want to make sure that you're assessing your IV site. No redness, no tenderness, no signs of infiltration to your patient. You also want to make sure that you do a really good job of teaching your patient of those same signs, what's normal and what's abnormal, so that they can alert you as soon as possible if they notice anything with their IV. Again, in the case of Stephanie here, and this being a saline lock, we would not have any continuous fluids going, which means that each time we access it, we'll need to do a mini procedure of what we just did as far as cleaning the hub with alcohol, and using the saline to check for patency before we give any medications. You never want to give any medications or products through an IV that's no good, and that's the purpose of the saline, to check that before you cause any dangers there. Now, in this case, she'd be ready to receive her medications. We would just kind of go over everything. Everything went great, Stephanie. The IV is in. Do you feel okay?
I feel fine.
Okay, and do you feel like you have a good understanding of what to look for and when you would call me?
Yes.
Okay, perfect. If anything comes up, please do not hesitate. At this point, you're good to go and you can follow your doctor's orders. Now, whenever it comes upon that the doctor either DCs the need for an IV or the patient's going home, then you will need to remove the IV. So in this case, we're going to pretend that Stephanie is going home. Stephanie, great news, you're all better.
Yay!
Your doctor says that you can go home, so I'll need to take out this IV.
Okay.
Do you have any questions or anything?
No.
Okay, great. I'm happy you had such a good IV experience. You'll know what to expect next time. So in this case, the tape has been here, and tape is very sticky, and a lot of our patients have very fragile skin, but even healthy patients, that can be an uncomfortable part of the process. So a good little trick that we've learned in nursing is to kind of loosen that. Now, there are some facilities that have adhesive remover, so you may be able to have some of that. If not, alcohol works great too. You kind of want to go right around the edges of your tape. Not only is that cleaning the skin, but it kind of loosens up some of that sticky stuff. All right, Stephanie, just cleaning you off here to get this tape out, okay? Everything looks good. While I'm doing this, I'm assessing the site. I see no redness here, no tenderness is reported. Feel okay? No signs of infiltration. This IV really looks great. I'm going to go ahead and remove the tape. There was no fluids in her. That was just for training purposes, but if there were, that would all be discarded in a biohazard bag. And the last thing you want to do is take out that catheter that's been in the skin. Now, we don't just toss this in the garbage, okay? We take special concern while we're holding pressure to the site in case there's any residual bleeding there to really look at this catheter. Most importantly, you want to make sure the tip of it is intact, that there's no obvious damage or piece missing. That would be a foreign body in your patient, and that could be a real problem. If that happens, you need to call the physician immediately to get further orders. But otherwise, if everything is good, it's something that you're going to note, and then this can be discarded as well in a sharps container or biohazard, since there is no actual needle, but it does need to be discarded properly. And that's the way you'll chart it, that you de-seed the IV catheter with cath tip intact, okay? And that's important to know, that everything that you put in has been retrieved and is now out of your patient. After you hold pressure, which can be anywhere from, a matter of a few seconds to a few minutes, depending on your patient and their other diagnoses, you make sure you have no active bleeding, and then you'll just grab you a little piece of cotton if you need a little extra pressure. If not, for your average patient with no bleeding, You'll just apply a Band-Aid. Now these are latex free, Stephanie, okay? Do you have any allergies?
No.
Okay, perfect. I know you feel like I ask you that all the time, but we can never be too safe. You'll put a little Band-Aid on, you let her know. Now look, I didn't see any bleeding, but you'll need to take a few moments to notice that. If you notice any blood coming through, that's something you'll just call me for, okay?
Okay.
All right, at this point, you can make sure that you take off your gloves and you're good to go.
In this portion of our video, we're going to discuss the 3 interactive concepts that you can practice there in the classroom. The first step that we're going to talk about is tying your tourniquet. Your tourniquet is the rubber band-like stretchy elastic that you're going to tie around your patient to kind of make their veins pop up. Bring it around the back, bring it up forward. You're going to bring one side around the back and bring it out just a little bit where you can pop it quickly and easily. So when you're assessing your patient's site, you want to make sure that you look at their vein, you want to assess their vein for any valves or any bifurcations. You wouldn't want to start an IV right in the middle of where a vein kind of veers off to the side. You'd want to go where your vein is the most straight. You can hold your patient's hand kind of down like this and play with the vein and play with the blood flow. If the flow doesn't stop or isn't interrupted when you pull it back like this, that means that you have a pretty good vein that doesn't have a lot of valves or anything like that. So that's kind of what you're looking for when you're looking for a good vein. I like to do before I even get started on my patient and before I even tie their tourniquet is to pull probably about a 5-inch piece of tape, and I usually rip it in half all the way down the middle. So you have 2 little skinny pieces of tape, and I usually put these just on my bedside table where they're close for me to grab. Also, like another piece.
And there are patients that can't have tape for whatever reason, or they have that super fragile skin. So a lot of facilities have alternate resources, so check into that if you do have someone like that. We've used Coban and other things in the past that are completely tape free but will still secure it. But most importantly, this is a great classroom skill because it needs to be secure. No one wants to get stuck for another IV because it wasn't secured properly.
Exactly. So we're going to act like Melissa just got her IV. As soon as I start her IV, I'm going to hold my pressure so the blood doesn't come out. I'm going to go underneath my IV while I'm holding pressure, and I'm going to cross over like this with one end, and I'm going to cross over the other end like this. This is called a chevron. I don't know if you can see that. Then I'm going to take more tape and go across.
Right.
Make sure it's snug in place. Then if you had tubing, I would normally wrap the tubing around the patient's hand and secure it up the arm